I think as our medications get better, as our ability to select patients get better, our therapeutic outcomes are going to be improved with medications, and the role for surgery is going to start to be less and less important, and we're going to surgery is going to become a method of last resort, but there'll always be the patients that have abscesses, that have highly developed fibrous polyps that are not going to respond to any sort of treatment, that just need to be debulked. So I think there'll always be a role for surgery, but I think the indications and the prevalence of surgery is going to decline over time. And while it's not a good thing for surgeons, it's a great thing for patients.
I think the future of surgery is really good for as long as I can see, which is perhaps 10 years, I think. And the reason why I think that is that what is going to replace surgery? The possibility of biologics. What's the problem with biologics? Their current cost, and the great majority, certainly in New Zealand, of patients with sinusitis are treated by a publicly funded system, and I can't see biologics with their current cost structure being funded. But it's a little bit more than just the drug itself. You've got to administer the drug itself, and you've got to administer the drug itself for a very long time. So we're going to need to have long-term safety profiles, and I think it's going to be quite some time before biologics are established for anything other than an adjuvant treatment for the really, really tough end of sinusitis. And so I think that for the foreseeable future, surgery will be a cost-effective treatment for patients who are recalcitrant after medical therapy.
The future of sinus surgery, I think, will be important. Probably our objective as ENT surgeon is to reduce the number of surgeries, because the future is to treat the patients medically and try to avoid this severity. Usually, surgery is always linked to the lack of control or high severity, and we want to avoid that with the new treatments. But probably we will, in some way, use these treatments to reduce the severity of the disease and to get these new treatments to work better. At this moment, we don't know that yet. We don't know if the biologicals, these precision medicine drugs that target the specific molecules, will be better at the beginning or in the more severe. The decision today of using these drugs in the more severe patients is an economic decision because they are very expensive. But maybe in the future we will find that they are much more useful at the beginning, avoiding or preventing the lack of control or the severity of these patients. We will see.